All right. All right. Thank you for everyone joining in today. This is the SSAT Mentor of the Month series. So I'm pleased to be joined by Dr. Maheswari Senthil today. So she is a nationally reputed, federally funded surgical oncologist that serves as the Division Chief of Surgical Oncology at the University of California Irvine. She specializes in the treatment of gastric and peritoneal surface malignancies. As a background, she obtained her general surgery residency training from the University of Medicine and Dentistry of New Jersey program before completing surgical oncology fellowship at City of Hope. She joined as faculty at Loma Linda University in 2010, where she founded the Surgical Oncology Fellowship Program, developed a peritoneal surface malignancy program, and ascended to the rank of Professor of Surgery and Division Chief of Surgical Oncology before moving to UC Irvine in 2020. In this role, she founded the UC Irvine Surgical Oncology Fellowship Program, earned R01 funding to study a vascularized microphysiological system to model peritoneal carcinomatosis treatment, and became the PI for the STOPGAP trial. This is a phase 2 clinical trial studying a sequential systemic therapy with intraperitoneal paclitaxel for gastric and gastroesophageal junction peritoneal carcinomatosis, which was actually recently approved by the NCI. Thank you so much, Dr. Senthil, for joining us today.
Well, thank you, Dr. Narayan, for having me to speak at the SSAT Mentor series. I appreciate it.
Absolutely. It is our privilege. So we'll be having a discussion today about her career centered on how to build a basic and translational science research program as an early career surgeon scientist. She'll also share some pearls on developing clinical trials as well, which has been a recent success of hers too. So let's get started off just talking about your recent R01. Congratulations for that. This was titled a vascularized microphysiological system platform for modeling peritoneal carcinomatosis. Can you share a brief overview of this work and what skills you gathered along the path of training from your residency in New Jersey, fellowship in City of Hope, and your early career faculty roles at Loma Linda and now UC Irvine that positioned you to earn this award?
Well, thank you. Yes, this R01, I believe, is a long time coming. But however, this specific work is really focused on peritoneal carcinomatosis and how do we advance management of peritoneal carcinomatosis. As you know, my clinical area of interest and my primary focus is management of patients with peritoneal carcinomatosis. And with the challenges we face with peritoneal carcinomatosis, one is novel treatments. And the reason why we have not been able to advance novel treatments in this setting is lack of appropriate in vitro models that allow us to test and identify drugs and drug targets that can then be moved into the clinical trials in a much faster setting. It's because it has its own unique challenges. With that in mind, I have been thinking about coming up with the best in vitro model. And I was fortunate enough to collaborate with Dr. Christopher Hughes, who has founded the tumor-on-chip microphysiological system. It's a 3-dimensional model. And based on the need of a peritoneal cavity, we have been able to improvise, redesign this model to create essentially a peritoneal cavity on the chip. So this peritoneal model has the peritoneal cavity as well as submesothelial stroma, allowing for us to be able to test either the intraperitoneal administration of agents or systemic administration of agents or a combination thereof, to be able to study novel drugs and drug combinations to manage peritoneal carcinomatosis. And our hope is to use this platform, validate this platform, and probably advance this into platform trials in patients with peritoneal carcinomatosis. So that's the idea behind this model. And again, the impetus is just to improve management of our patients.
That's amazing. It's a lot of work to put together, and it's a fortunate collaboration at this time too. I'm curious about your background that positioned you for this opportunity too, because I'm sure you've had training in grant writing as well, and your research lab experience leading up to that. It's interesting sometimes that some of that prior to this can be tangential or directly related to this work. And I'm curious to hear about some of the work that you've done before that's related to this, either clinically in the same field or from a basic standpoint, a basic science standpoint, some of the modeling that you've done before that may be relevant.
No, that's a great question. What I wanted to share is how atypical my pathway to NIH funding is. It is unlike any other usual story that you would hear, is because I have never been K-funded, and I was not on a research track in my early career as a faculty at Loma Linda. But what did help me is that all through my training, I have had experience with translational science. So even before joining surgical residency, I was in Dr. Judah Folkman's lab for about a year prior to joining surgical training, and I had quite a lot of hands-on experience in translational models. Especially, we were developing an organoid model there for skeletal muscle tissue engineering. And then subsequently, during my surgical training at UMDNJ, I spent 2 years in Dr. Deitch's lab, which is also a translational lab, where I dedicated 2 years of my time working on animals and a lot of different basic science and bench, wet lab techniques. So that gave me a lot of familiarity, and I continued that during my fellowship. So translational science was never foreign or intimidating to me, even though during my early career, most of my time was spent in becoming the clinical surgeon and developing the expertise that is needed to build a very strong peritoneal malignancy program. Right? But however, I never distanced myself from research at any point. Even though I myself did not have a wet lab or was K-funded during my early career, I knew research is going to be an integral part of my career, and I needed to stay very, very close to it. And in that setting, I have always been keeping up as well as curious about the gaps and how to fill the gaps. And there are so many gaps in the field of peritoneal carcinomatosis. There is no scarcity for gaps when we manage patients with peritoneal carcinomatosis. Each one of that is a research question. And I was just trying to figure out the right collaborations to expand on these gaps. And that's what happened, is because I knew we needed to develop an in vitro model. And my collaboration with Dr. Christopher Hughes is just an extension of that immense need that we have in the field.
That's a really awesome explanation of how having related experience, but not directly within the same concept that you're studying, can be super helpful for building out a lab. A lot of trainees often are working in a specific field, perhaps interested initially in pediatric surgery, but exactly as you mentioned, some of those skills that are gathered from that training can be very relevant for surgical oncology or minimally invasive surgery research with a translational or a basic science bent. That's awesome.
Absolutely. It's because my 2 years in Dr. Deitch's lab was on trauma hemorrhagic shock. Yeah, so completely different from cancer, but the technology and the techniques that we learn are translatable.
Absolutely. Well, so I want to shift gears, kind of alluding to one of your comments earlier about how you had to shift gears yourself and build a busy clinical program, because the environment where faculty start can be very critical for their long-term growth. For you, starting out in your first role at Loma Linda, I'm curious to hear about what opportunities you leveraged there, or that you created for yourself there, that facilitated your career growth to get you to the position you are today.
Yeah, that's a great question. As I mentioned, I knew research is going to be integral for what I want to achieve in the field of peritoneal malignancies. And during my early period, while I was building my clinical practice, I knew the best way that the surgeons can get involved in science is by saving biosamples. You need to collect your biosamples to be able to have a meaningful amount of samples to provide for translational science or do your own. And hence, I was able to leverage the biospecimen repository. And every single patient of mine was consented into that biospecimen repository, and we started collecting matched tumor and blood samples. And by few years, I had this very rich repository of samples. And at which time I have been studying the possible gaps that we had. And one of the gaps was liquid biopsy markers. And circulating tumor DNA was coming into the field, but however, it was very evident that circulating tumor DNA is not going to work for mucinous cancers or peritoneal carcinomatosis for that matter. So I had done clinical research that then informed my translational science. I wanted to study exosomes because I was doing literature review and search and figuring out as to how to solve this liquid biopsy problem for peritoneal carcinomatosis. And that's how I came into exosomes work. And I was able to find a collaborator at Loma Linda who was also doing exosomes work, Dr. Nathan Wall. And we partnered together to get a seed grant that resulted in our first work on plasma exosomes. But that was all the samples that I had saved up to then to be able to help us move this forward, because we had patient samples already saved at multiple time points, which was enormous to get our first work and the proof of concept completed.
So I'm curious to understand, where did you get some of the funding to support that initially before the seed grant that you mentioned? Was that built into your package that you negotiated in, or was that as part of the directive of your hiring that you wanted to build this out and the institution was aligned on that?
Oh, that's a great question. Actually, the biospecimen repository was an institutional resource that was available to all researchers. So you're just spending your own time consenting the patients and making sure that you're coordinating during your surgical procedures that these samples are being appropriately collected. It's more of your time and effort, but no additional funding was necessary to collect samples into the biospecimen repository, which is a phenomenal resource overall. And to be able to leverage that is important because for trainees and young faculty, you got to understand what resources are already available in any given institution that you go in, and make sure you're using all of those resources to the fullest extent possible. And that's actually more than you think, is because not everything that you do need additional funding. The institution may already have a resource for that, and you need to know what those are and how to use it for your purposes.
Awesome. Okay. Well, I want to shift gears a little bit to the present now, because I'm curious about how you are now as a mentor for your research mentees or your fellows currently. So I'm curious, when beginning a research project now with mentees in your group, what is your approach to guiding them when studying a new space for them? Do you take more of an unstructured approach where the mentee will fill in the gaps and therefore learn in the process? Or do you have specific practices? Like I've heard of some people asking their mentees to craft skeleton tables and figures that are empty, but will make up the eventual manuscript. And do you have a different approach when mentoring trainees for basic science, translational, or clinical outcomes projects?
That's actually a fantastic question, is because it also falls into how do you develop a mentee to think independently, right? So when a new mentee comes into a research project, the question always is, do you understand the why? Why are we even doing this? Why is this project even important? So that fills in the background and the clinical gap that we are trying to study. So my ask to them is that understand the why, and let's talk about the why first, which is essentially the background and literature search they have to do so that they truly get the concept and what we are trying to accomplish through this research project. And then comes the methodology. So my expectation for a mentee is the background and methods are almost done even before starting a project. Essentially, they should. And the results and the discussion is filled in as they develop more of those results coming in. And each figure that goes into a paper is one part of what they have done and slowly developing that. So that's what I expect my mentees to do, is to make sure they have started writing the paper as they are getting involved in a project. And really, it's about truly understanding the reason behind as to why we are even conducting this and how this would inform future research. Because research doesn't stop with just one project. Even some of the clinical research that we do informs our translational science or other bigger projects that we are doing. So none of our clinical research stands alone, right? An example is we did a literature, essentially a retrospective review of a circulating tumor DNA in peritoneal carcinomatosis. And that's one of the projects that one of my mentees did. But that is to show that there is a gap, and we are trying to fill that gap with a liquid biopsy using exosomes, which is the translational science work that we are doing. And that is how I really train my mentees, is to think really broad and truly understand how the clinical work will inform other bigger science.
And I see that in some of the work that you've published as well. Your lab has been very productive and very impressive in the breadth of work that they've done that spans all the different realms of research that we've talked about too. It's great to hear that this is a nice structured approach, that it seems it's very efficient as you're doing your research and preparing for a study. You're already working on the manuscript as well. I think that's excellent advice. Stemming into a next step for advice, just following the progression of your trainees. Let's say you have a trainee that's on the pathway of beginning their surgical career. What advice do you have or tips for the transition from training into practice for your surgical oncology fellows, for example?
Yeah, when it comes to practice, right, and then you want to become a surgeon scientist, if that's the path that they want to choose, then they really have to understand that it is a long road and being strategic about as to how they will develop their resources, their network, their mentors, has to be thoughtful over the course of a long period of time. And initially, as surgeons, there is a great need for us to be clinically strong in the field that we are going into. That's expected of you to be a master clinician in the area that you're willing to advance the translational science. And hence, it's a balance between having that clinical experience and also having adequate time to perform research. And you have to know what your balance is, and it is based on the institution that you get your first job, understanding the resources available in the first job, and what they have really hired you for, right? However, no matter where you end up, and no matter what the resources are, if you are truly committed in becoming a translational scientist, I think there is a pathway for everyone to do that. And I basically say, if I can become an NIH-funded researcher, I think anybody can. Truly, honestly, they can. Yes, because, I started off as a 100% clinician, operating 3 days a week in a completely clinically intense setting, right? But the goal is to make sure that you're never losing track of what you really are trying to accomplish. And the main thing I would say for junior faculty is have an alignment. Have an alignment between your clinical work and the science that you want to pursue. If it is completely diametrically opposite, you're never going to have enough time for both. It almost has to be the same. What you're practicing should be what you should be studying. And if you are, then at some point, they are so intertwined. Your science and your clinical practice is no longer a separate thing. It's all one and the same, which is what you're hoping to accomplish. In order for you to be a successful scientist, you really have to have that extreme alignment between your clinical work and your science. And so then you don't have to parse out my clinical time and research time. It's the same.
So
It really is the same.
I'm curious to hear from your perspective as someone who started as 100% clinical time and figured a way that research can take up more component of your full-time employment. For others that are seeking employment now where you have a 50% role in research and 50% as a clinician, do you see that as an advantage in terms of building your research program? And conversely, is that a disadvantage in terms of becoming clinically independent just because you have half the amount of time to become proficient in the OR as a first-time job?
No, I think it's always a good idea to have some dedicated time for research. Absolutely. I don't think there's anything wrong with that, is because you don't have to be 100% clinical to be clinically proficient. No, it's always nice to have some dedicated time for research so that you know that that time is going to be devoted in developing your initial papers, your preliminary work, having time to networking, going out for conferences, seeking more collaboration. So I think it's fantastic to have that time. It's just what I was referring to, even with 100% clinical, if you really have your mind set on developing your own wet lab and becoming a translational scientist, it is still possible. It takes longer, and I don't think it needs to take that long. I do think that in situations where people have dedicated time and the proper mentorship and are able to leverage that time properly, then they would get to becoming NIH funded at a much shorter period of time, which is what we want. We don't want a decade after which they get NIH funded. We want them to be early career scientists where you're also using the opportunity to get funded with NIH's consideration for early investigators.
Okay. And I guess as the last question that segues well from that, so what advice do you have for trainees that are hoping to pursue a career as a funded surgeon scientist? So what experiences do you think are critical for them in particular in training to seek out, either as part of their resident research time, or if they have a year between medical school and starting residency, like you had mentioned as well, to get involved in the type of training that they think will be critical for them as a surgeon scientist in the future?
Yeah, that's a great question, is because in order for residents to become surgeon scientists, I do think that they need to have dedicated research time. You really need to familiarize yourself with the concepts, the setup of a translational lab, even the vernacular that gets often thrown around so that it's not intimidating to you. It's like, I know what that setup is. I can actually set my own lab. It's not that complicated. So just that confidence itself is essential, is because that kind of exposure can happen under the guidance of a mentor. And while they are in the lab, I would strongly encourage for people who are really interested in having their own wet lab, not only think about the science part, but the parts that require you to set up a lab. You need a space, you need certain equipments for yourself. How do you get funding for those equipments? And also get involved in grant writing. And even the early training grants that they can write during their time in research is a good practice, is because grants, although they have scientific component, which is how they get funded, there's a lot of administrative components. You have to understand, where do you submit the grant? Who are the people who process the grants? What are the requirements? What are the timelines for submitting grants? What are the different resources that are available? So there's a lot that they can learn in addition to learning how to conduct good science, how to write thoughtful papers. There is more to the time that gets spent in the lab to kind of have all the necessary skills to become an independent scientist.
Mm-hmm.
And I would say that it has to be intentional and thoughtful when they're in the lab.
And that makes sense, because you are planning and preparing for your future career. So it's not just time to pump out papers, but that is a critical period to gain the skills that you're going to need to do the work that you're getting mentored in and mentoring others to do so in the future. Absolutely.
Absolutely. Absolutely. I would say what has helped me overall is always learn from your patients. Like, whatever I'm doing today is merely my interest in improving patient outcomes. It is translational science is one way to get to it, or clinical trials is another way to get to it. You can be either. You can be a translational scientist, you can be a clinical trialist, or you can be both. But the impetus is always to improve patient outcomes. And for me, every single research question that I have, and I have had in the past, is all based on a patient experience that I didn't understand or was not willing to accept that outcome for my patients, and say, how can I make this better? And then that's the reason why all of these translational models or exosomes-based research, or even the STOPGAP clinical trial comes from, is because we are not willing to accept the status quo. And we want to improve outcomes of patients. And you can accomplish that through clinical trials, for sure. And I think that's also another area where mentees or surgeons should be actively looking to pursue, is how do we advance clinical care through clinical trials?
That's a wonderful note to leave it on. Dr. Senthil, thank you so much for your time. This has been a great conversation. I really appreciate you chiming in and sharing with us your journey and your pearls on how to lead a successful career, as you have as well. Thank you so much for your time.
Thank you, Dr. Narayan, and it's a pleasure to be here.